Good morning and good afternoon to everyone. My name is Donna Thorson and I'm a Senior Improvement Advisor at Comagine Health. I'd like to welcome you to our presentation on innovative activities, preserving functional ability during the time of COVID-19, brought to you by our Comagine teams from Idaho, Nevada, New Mexico, Oregon, Utah, and Washington. I'd like to say a special thank you for joining us in the midst of this incredibly stressful time. We are here to support you, and we will be recording and posting this session for those of your colleagues who are unable to attend today. A few housekeeping tips before we get started. We'd like to ask you to let us know who is joining us on the webinar today by entering your name and the facility into chat. And if there are other folks joining you, please enter their names as well so that we have an accurate count of the participants. For now, your cameras and microphones are muted. And if you would like to ask a question, please put it into chat. We will be facilitating a question and answer session at the end of the presentation. And when you do that, please make sure that you're chatting to all panelists and attendees. We're excited about today's presentation, and I'd like to introduce you to our presenter, Elisa Tagg. She is the Association Director of the National Association of Activity Professionals, has been certified as an activity consultant since 2006, and an activity director working primarily in skilled nursing facilities since 1995. Elisa serves as the Chief Executive Officer of the Southern Nevada Activity Professional Association, and she enjoys teaching the MEPAP course to new activity professionals, and also works as an independent consultant in various facilities throughout Southern Nevada. Elisa holds a bachelor's degree in psychology from the University of Nevada, Las Vegas, a provider's certificate of completion specializing in aging with the Nevada Geriatric Education Center, and is a certified Alzheimer's disease and dementia care trainer. A certified dementia practitioner with the National Certification Council for Dementia Practitioners, and a certified dementia communication specialist with the Silver Dawn Training Institute. Elisa is the past president of NAAP. She also has always enjoyed working with elderly populations for the majority of her life and has a great love for the elderly. In 1988, Elisa was named the Indiana Healthcare Association Teen Volunteer of the Year. Elisa speaks on local, state, and national levels on various topics relating to healthcare and the activity profession. And I have had the pleasure of working with her a couple of times. I'm thrilled to be bringing her to you today. She's going to be joined today by Jan Swallow and Talia Jones, who are going to share their experiences from their own facilities. And I'm now going to turn things over to Elisa. Let's do a quick check on the audio to see if can hear you. Elisa, can you say hello?
Hello, everyone. Hi.
Is everyone able to hear her? Yes, all right. So Elisa, you may get started.
Sure. Thank you so much for that awesome review of my life. It's always fun to hear everything that you've done, and sometimes you wonder how you've done it all, but I am very honored to be here today, and thank you, Donna, for this opportunity to speak with you a little bit more about functional preservation with activities. And so just a little bit about myself, a little bit more about myself. I've had the opportunity to live in Southern Nevada now for 30 years, and I really love seeing the growth and the development that has happened. Where I lived in Henderson, where I currently live in Henderson area, there were no nursing skilled facilities or assisted livings when I first lived here, and now there is a plethora of them, and it's just amazing to me the growth that has happened, and then the need that goes with that growth and organizing and understanding what is happening in regards to activities, especially in the arena of the healthcare. So some of the objectives we're going to be looking at today is understanding the importance of activity programming during isolation. And we're also going to be identifying best practices and ideas that will continue for successful programs, as well as discovering ongoing resources that you may or may not be familiar with. And then I have invited Jan Swallow and Talia Jones, as stated, and they will be sharing some personal experiences that they've had from the field. So one of the things that I wanted to just really touch on is why activity interventions are so extremely important, and especially at this time. You know, we have a lot of individuals that are really suffering during COVID-19, whether they have been tested positive or they're negative, and they are having to isolate themselves even more. And as we look at the reasons why activity interventions are vitally important, we must recognize what the activity interventions are as well. And some of the things that we can look at is with activities, it helps to keep individuals really active and engaged, and it provides those moments of pleasure or joy. What we have found is that anxiety and irritability is decreased when an individual is engaged. And also it allows for opportunities to foster emotional connections, encourages that self-expression and individuality. And it doesn't really matter what level of care you're living in. It can range all the way from living at home by yourself and your elderly, all the way up to the skilled nursing arena. These interventions will be very helpful to individuals to ensure that their needs are being met. So one of the things that is extremely important when it comes to activity interventions is to know the individual. It is very important to understand the background of the individual, because this is going to establish a foundation of an effective partnership. And as stated, I am the Association Director of the National Association of Activity Professionals, and we have members in every single state. And as I've been reaching out to them, whether it be via social media or phone call, just to check in on how they're doing and get ideas and suggestions from them on what's going on in their setting, these are the most important thing that comes to mind, is to know the individual. One of the things that has been shared with me, you know, say we're an example of a 100-bed facility, we'll just use that number, and maybe you had 25 to 30 residents who were extremely active and came out every day to attend the programs that were on the calendar. So you were missing that population of 75 to 60 individuals on a regular basis if you weren't doing good, high quality one-on-one visits with them. And the thing that has improved with COVID-19 is now every resident is an individualized one-on-one visit. And they're really getting to know these residents on a deeper level as they go out and meet with them on a regular basis. So knowing the individual, personal background, their cultural preferences, their cognitive health, their physical health, their sensory capabilities, their spiritual needs, and their communication preferences are vitally important in understanding when it comes to recognizing who the individual is as a human being. And we all know that how the regulations read, that we cater to the one, you know, that we recognize the preferences and the interests and the ongoing changes that happen with the individual, because everything is individually based. And if we don't know these things about the individual, we're not going to be able to meet their needs. And that's really important as well. Also, we need to recognize any mood changes or functional changes, any preference changes or appetite changes, especially right now during COVID-19. All four of these can be affected in one way or another. Talking with other activity professionals, we've seen weight loss that's happening because of the functional losses of laying in bed all day long or not doing anything or not feeling good to eat. And so activities have been called up to help in passing out the food carts and more food related activities. And there's been lots of great like root beer float parties, ice cream socials, popcorn events, and things like that will help with the appetite. Functional changes, of course, as they're laying in bed for longer periods of time, the decrease of functional mobility happens. And so activities is part of that process too, to engage the individual in their functional needs. As well as mood. We are really seeing an increase in depression that's happening now as well because of being isolated from our family members and our other loved ones. And so this becomes a problematic thing as well. Just to share a personal experience, I have an elderly mother who still lives at home alone. She lives in Las Vegas as well, but she's still a half an hour away from me. And when this all went down in March, she chose to isolate herself in her home. And she didn't go to the grocery store. She never left her house, and she would not allow anybody into her house this entire time up until just last weekend. And that was really challenging for her, as I would touch base with her on a regular basis, and we would FaceTime frequently, but it was not enough. I could really see a difference happening in my mom. And when I would bring groceries over, I would have to leave them on the doorstep and leave. You know, I would make her come to the window just so I could see her and make sure that she's okay. but she refused to let me enter her home, and I understood that, and I respected that. But I could also see a real change happening in her as she continued to isolate herself from others. And about 6 weeks into her isolation, she had a fall in her backyard and really took a bad tumble and kind of laid on the ground for a bit and realized, I don't know how I'm going to get up because I don't have anybody here to help me. And it was just interesting because my brother happened to have the feeling, I guess, to reach out and call her. And thankfully she had her phone near her that she was able to answer her phone, and he was able to talk her off of the ground. And he went over, he also lives in town, and he went over and checked on her through the window, through the gate, of her backyard, to make sure that she was okay. And she still kind of experienced some residual pain up until a few weeks ago, as she was trying to recover from that fall. Thankfully, she didn't injure herself to have to be hospitalized, but it was kind of a scary time for her because she had isolated herself. And so we can see how all of these things can really affect an older person during this time, and especially somebody that maybe has any kind of memory impairments. And one of the things that I like to point out when we talk about memory impairments is that behavior is nothing more than a means of communication when words are no longer effective. So we really have to look at when these behavioral outbursts start to occur, as we call them. We really need to put our detective hats on and pull out our magnifying glasses and to see what's really happening. Is there pain issues? Is there thirst issues? Are they bored? Are they hungry? Or is there some loneliness happening? And of course, all of these can be factors during this time of COVID as well. So some things to think about: the benefits that come from activities. The benefits of activities are innumerous. As you can see, on the screen, there are so many things that happen when activities are engaged and involved. And some of the things that I really want to point out are how they can really improve and increase personal relationships, as well as strengthening and maintaining muscles, and decreasing those repetitive behaviors that we may not want to have. One of the things that I have learned in my experience too is when we are engaged during the day, we sleep better at night. And one of the things that I've also noticed, of course, during COVID and being isolated, is we sleep a little bit more. We're kind of becoming bears in the winter, so to speak, and we're hibernating just a little bit more just for our own health protections. And it's causing us to have irregular sleep patterns, and that can trigger lots of other issues that can come from having the irregular sleep patterns. And so keeping an individual active and engaged during the day will help to increase the nighttime sleep. So if you're not fully there, of course, CMS has issued some guidelines. And one of the things that I just want to refer to with these guidelines is, of course, the restriction volunteers, entertainers, and family members. That all restrictions are in place except for the health personnel and any compassionate care situations that may occur. This has been really challenging, along with restricted visitors and the volunteers and the entertainers. Our barbers and our beauticians have been restricted, and so there's a lot of self-worth issues that are happening with our residents as well, because they're not to fully cater to their needs and their desires. Family is a vital, important role in a loved one. And when we see them anymore, and all the things we're doing are great. We're setting up drive-by visits, time visits. I've seen facilities that are multi-story where the fire department gets involved and uses the lift so the loved one can be outside the window. These are all great substitutes, not the real thing. And that can be really challenging as well for the individual. And activity professionals that are on their own, that don't have staff working with them, had many times relied on the volunteers to help them with the program implementation, and now that's not available either, as well as the entertainers that really took a big part of the program process with our residents as well, and keeping them engaged and active. So there's lots of things that we need to consider as we work through this process of the new normal, as we've all heard so many times. One of the things that I think is vitally important is how we can move beyond games and puzzles. These were fine in the beginning, to have games and puzzles happening and individualized activities of this nature to help the individual get through the time. But engagement is so much more than just bingo, and that is something that we really have to look at, how we can develop a better relationship with our activities programs to ensure that we're not just providing programs anymore, that we're providing services, because this has extended into that next level of thinking, moving away from programs and now into more services. So looking at, how we can have opportunities to decrease anxiety and irritability, how we can foster emotional connections and encourage that self-expression and individuality is a great way to go about this. One of the things that I'm hoping that many of you are already using is technology. Technology has really changed the world of engagement, and we're doing that today with Zoom. We're being able to meet together in this level of learning, which is, again, the new normal as we move towards understanding how we can still gain our continuing educational opportunities. And socialization is vital in the lives of our elders. They used to have that. And so these are some options, if you're not already that in your settings, to allow for individuals to have conversations with loved ones. Because a personal conversation is valuable and important, and this really helps to increase engagement experience, so to speak. And there's lots of different ways that you can do that. Another one would be to look to provide some other opportunities for engagement through reminiscing. Maybe you could have family members draw photo albums in your off locations, and the individual can look through those and have reminiscing opportunities to talk about their families and loved ones. Magazines and newspapers also provide that opportunity. And just recently learned that the surfaces do not have such a high infection in them. So if we want to leave them out, for wherever period, and then we're able to use them. But of course, these would be one-on-one, and they would need to be left with the individual of who they started with. Other things can happen, discussions. We've gone through a few holiday COVID-19, St. Patrick's Day, we had Easter, we had Passover, we had all kinds of other opportunities that were happening with our residents, Mother's Day, all things that were really important holidays, and having discussions on those holidays and maybe what cultural events took place during that time. Even seasons, now we're changing from summer as we're still in this process too. And travel, we always love to talk about travel, and there are so many wonderful resources that are now available on the internet. Travel agencies, there's a European travel agency that has released all of their travel tours for individuals to watch through their website. And what a fun thing that would be to travel Europe from your bed, so to speak. Cookbooks become a really important time too, with looking at recipes and working on projects and talking about, what kind of meals did you serve at Easter or Passover? What did you do during Christmas and Thanksgiving? Talking about these special events, that may be time-honored events for these individuals, and now they're not able to really enjoy them like they used to in the way that they used to. And journaling is such an important thing too. How many of you have taken the time to write your thoughts and feelings about COVID-19? Whether they be negative or positive, that is such a great opportunity for yourself to talk about COVID-19 and your own thoughts for next generations to see and read about. And same with our elders. It would be interesting to hear, their thoughts about this, because some of them may have lived through other times of quarantine or isolation, and to get kind of the comparison of what they're going through now to what they went through before. Also, book reviews or articles of interest reviews, these are really good things too to have discussions with. As you can see, a lot of these are discussion based, but this is really what we can do at this time, is to have conversations with the individuals, and so that we can better meet their needs as well. Other things to look at, reading and writing poetry. Why not write a poem about COVID-19? How fun that would be. And you could do this from room to room with your residents too, and have every resident engage in maybe writing one line. And of course, if you get to the end and it doesn't make a whole lot of sense, it doesn't matter, because it was an opportunity to engage and to have thinking time and to discuss what's going on. Scrabble is a fun activity as well. I know that's a game, but this one looks at really digging deeper with the spelling and able to find that. And there are Scrabble games on technology based, so you don't have to have the actual board and tiles. You can do this on a computer type game setting as well to be able to really interact and engage. Cake decorating, now we're coming into, as we transform into June, we're coming into the season of weddings, and we'll have a cake decorating contest. You can do cupcakes and have the individual supplies given to each of the residents in their rooms, and then you can take pictures of them and display them in some way or another. Art gallery virtual visits. There's so many art galleries that have opened their doors virtually and have their visits available as well on their websites to be able to take a walk through their gallery and to see what's going on. And simple no-mess crafts, these are really fun too. Again, very similar to how you would do cake decorating, to have the craft and then take pictures of that and share that with the other residents through the photos. Exercise is also extremely important, especially as we, become more room bound and bed bound. There's so many things that we can do within our rooms to stay functionally set, to exercise, to move and to shake and to do different things. And you can lead exercise programs over the PA system, over your in-house television system if you have that available. There's so many options to still be able to do exercise, and even one-on-one, to go in and work with the individual and just have them do different things so that they can still preserve that functional mobility. Other suggestions could be folding laundry in their room. You can always take laundry into the room and then take it back to the laundry and have it rewashed if it's, for infection control purposes. But this can be a very soothing and therapeutic activity for many, especially our memory impaired residents. That is something that they find of worth, that they're able to do something that makes them feel valuable. Organizing drawers. I'm sure we've all done this in our own homes where we've been cleaning things out and kind of minimizing and doing different things. This can be a great opportunity for the elders as well. And jewelry box and toolboxes, fun things to sort through as well. Of course, all individualized one-on-one. And newspaper and unclipping. This is a great avenue as well, because you can also have a reminiscing activity with the coupons to discuss the different things that you can use the coupons for. Music appreciation is probably the number one thing that many of us may or may not be doing, but I would encourage you to really have good, strong music appreciation programs happening, because music is the universal language, and it's very soothing for individuals as long as you find what their individual style of music is. That's why knowing the individual is vitally important too. For myself, I'm a big fan of Def Leppard and Heart, but you may not be, you may be more of a Frank Sinatra or even an AC/DC kind of individual, and we need to know these information so that we can ensure that we're playing the right music. And spiritual discussions, this has been a huge conversation in the world, with spirituality and churches being closed. And of course, now our spiritual volunteers cannot come into our communities like they used to be able to provide that spiritual support. And spirituality is essential for so many of our residents that we need to determine ways to figure that out, how we can continue to provide that. One of the facilities I work with, they have individual residents who are of a certain faith, and they have staff members who are of that same faith. So they're providing the spiritual conversations on that level, since the spiritual clergy cannot come into the community. And that's been a great way to continue that spirituality time. And hand massages, we talk about not touching one another and different things, but this is still a soothing thing that we can do properly by following infection control guidelines to provide that comfort that the individual may need at the time. Other things to look at, plants, it's gardening time. Why not give each resident their own plant and have it sit in their window so that they can watch it grow? Do a planting activity with them. Looking out the window, ensuring that the blinds are open so that they can have the sunlight coming in. And that helps to differentiate between night and day as well. Fashion shows. This is one of my favorite activities that I've seen happening that I highly encourage. This could be fashion showing whatever PPE items you're wearing and walking down the hallway, or any kind of dress up days that you've been doing, and to have just the staff walk down the hallways so the residents, and maybe in their doorways or in their rooms, can see what's going on and kind of enjoy a little fun time. Guided imagery, this is kind of a new age technique kind of thing, but it's really helpful too, to have these opportunities to really sit and think and take yourself to a different place in time. Aromatherapy can help with guided imagery as well. And these are some great areas of functioning that you can use with essential oils, of course, with a physician permission to ensure, that the infection control needs are utilized as well with aromatherapy. And why not do Google Maps? How many of you have ever Googled your own childhood home and how fun that is to see that on a Google map to see what it looks like today? We did this with my mom, and her childhood home has been destroyed, and it's, you know, now a grocery store or something else on the land. But it was very interesting to have that reminiscing opportunity. And then she was able to talk about some of the things that she did in her childhood at that home during her childhood times. So I really would like to take a few moments. I have, you know, invited a couple of guests here today. And so I want to have, I know Talia is with us, Talia Jones. I'm going to have her speak first with you all in regards to some things that she's been doing in her community. So Talia.
Hi, everyone. It's so nice to be here with you today. I hope everyone's doing well in this time. I am an activity coordinator in Las Vegas. I work at a continuing care retirement home. I work with independent living residents. So it's a little different than the residents we have here in assisted living and in our skilled nursing or memory care. Most of our independent residents are just that, they're independent. And although we do plan many things for them on a regular basis, with being in this COVID-19 situation and having everyone in isolation, they are really needing us more and more. So we are utilizing the technology and the virtual resources. It's just been a lifesaver in order to reach everyone out there. We are fortunate here to have an online platform that is called Touchtown, and we're able to upload information online and stream it so that every resident here can see it on a TV station in their apartments. We're able to upload different things like videos, so we can record our own videos, or also upload from YouTube. So what we've done with that is kind of modified the normal activities we would have on a regular basis. We show a fitness class twice a day, every day. Some of those were recorded by our fitness coordinator, and they are kind of personalized for our residents. They are kind of geared toward things you can do in your own home using soup cans and water bottles for weights. And then we've also utilized YouTube in a way that's able to provide new programs that we didn't have before. Maybe some things that we didn't have the instructors for, like we do a beginner's seated boxing that everyone really enjoys, seated Zumba class, different fun things to kind of spice it up around here. We also provide a video on guided meditation. We do one early in the morning and one in the evening so that the residents can start and end their day on a positive note. Intellectual videos, we normally have great courses here in the building, and what we do now is we're able to stream those, the different TED Talks, instructional videos like how to use FaceTime or how to Zoom. We also are a little creative with it. So we actually have a daily news show that we have been recording, and that involves our executive director, our hospitality director, myself, and then we will occasionally have a special guest, maybe from another department, to give updates on, say, dining or with maintenance. We also invite a resident here or there to share some fun stories. You know, we throw in the cheesy jokes to keep it lighthearted. As far as entertainment goes, we actually have been able to reach out to some of our regular vendors who have been nice enough to film video performances to send to us that we can use, where they're able to customize them, say hello to our residents, and that's just, you know, it makes it more personal, and our residents really enjoy seeing a familiar face and knowing that there's a little bit of normalcy there. It's just a really great way, even though everyone is watching this, you know, in their own homes, kind of alone, they're still connected because they're all watching the same thing at the same time. So they're able to discuss it later and ask, you know, did you see that show? So it's kind of a nice way to keep that connection going for them. Along with the videos, we're also able to put different slides with text. So we've been using that to put you know, fun things like the joke of the day, inspirational quotes, silly animal pictures, things like that. We use it to provide announcements like what time those videos will be broadcasting, the dining menus, of course, whatever updated policies or news that we have to share that is specific to our community. We also use it to let them know what kind of fun social distancing activities we have coming up. So some of the things that we've been doing here include different, like, activity carts. Our most popular is the happy hour cart. So we go on Mondays and Fridays. We split up the community into 2 days and we theme them. So every week we have a different theme. This week is Hat Day. We have a Western Day, Hawaiian Day, just fun things where we're able to involve the team members, the employees, as well as the residents, and they just get a kick out of it. You know, it's something to brighten their day and make them smile. It allows them to be creative as well, to look through their closet to see what they can put together. We've had shelf decorating contests. There's each of the apartments have a little shelf on their doorway, and we do themes for that. We had a specific COVID-19 theme, and the winner created a bouquet of flowers that was made out of toilet paper. So just really fun stuff. And it's amazing to see the creativity that is coming from our residents in this time. Another fun activity that we put together was something I called quarantine bingo. And this was a sheet of paper passed out to all the residents. And in order to get their bingos, they had to actually call on their neighbors and other residents and ask specific questions, like they had to find someone who hadn't changed out of their pajamas all day. They had to find someone who had been watching the fitness videos, all very quarantined, and it kind of went with this time, and it was fun for them. It was you know, it was funny, and it was also something that they were able to do to keep connected within the community. They were encouraged to call on their neighbors that maybe they didn't know so well and relate to one another, that sort of thing. So that was a real fun activity that we had here. Working with independent residents versus residents in assisted living and in skilled nursing, I've really seen so many positive and benefits in this situation, with having to visit everyone one-on-one and go to the rooms to deliver things and see them, making phone calls to check on everyone. You know, you really get to know them on a different level. Like Elisa touched on before, when we have our normal activities, you know, maybe 30 or 40 residents are regulars, and you really get to know them because they show up for these things. You know which activities they enjoy, you know which ones they don't tend to come to. But with this, it is so individualized, and it's just provided an opportunity for us to really get to know these other residents. So that's really been a blessing. And you know, you have to look at that positive in all of this. And I think that we're able to do that. And especially with activities, it's just showing to be such an important thing, especially in this moment.
Thank you, Talia.
You're welcome.
Appreciate
Thank you.
I now have Jan Swallow share with you.
Hello.
Hi, Jan. How are you?
I'm good, thank you. Sorry, I didn't unmute.
You're good.
So I'm Jan Swallow. I'm the activity director at Life Care Center of Las Vegas. We are a skilled nursing facility, and we have 178 beds. 54 of those beds are what we consider our anticipated short-term stay. More subacute coming from the hospital for rehabilitation, and expected to discharge to a lesser care, whether it be home or an assisted living, and what other options are out there. So we have 124 in-house residents that are long-term care. And of that 124, 24 of them are part of our memory care population. And as this COVID-19 has impacted our facility, our census has dropped to 122. 30 of those residents we have full access to. So all of the others are in some type of isolation. And we've been very creative as we've taken our different phases and slowly incorporated isolation precautions to different areas of our facility, because it all didn't happen at one time. Went from, 1 unit to 2 units to 3 units that are all definitely within what we call a bubble. There's a plastic barrier between them and the general area that is considered the safe zone. So in going to assure that those folks have everything that they need, the activity team has been very creative with going to the doors where the staff are able to access each other, to offer activity packets of things that we know each resident would like to do, whether it's simple crafts or a newspaper, word search, the daily bread, some type of worship material, and the bundled care team that's within that bubble will then take it to the resident and guide them through it. There's some therapists working in there, nursing assistants, and the licensed nurse. And then we ask them at that time to go through and open as many blinds as they can that are appropriate, and the activity team will then go around and do window visits with a list of phone numbers to call the residents that are able to pick up their telephones or even use a cell phone if they have it, to have a conversation, use a whiteboard, dry erase board to just write a smiley face or say hello or ask them if they need anything. We do facilitate and work with that bundled care team in getting video chats set up with the families, being the first line of contact with the family to make sure that they have a device on their end and have the right app loaded onto their phone or iPad to make that call, smooth transition to hand off the device to the team that's within that bubble. As we're working with the folks that have a little more accessibility, we're doing a leisure cart that we push down the hall to offer the books and magazines and newspapers. Our residents are all confined to their room, so we use our energy for positive interaction within the room. We're not doing any themes because it's taken such a long time to change the thought process of our residents to kind of subdue themselves. We're keeping it very quiet, providing one-on-one conversation, doing simple crafts, offering drop-off crafts in the rooms that the higher functioning folks can do, taking the time to do an extensive one-on-one with conversation in those rooms that we're able to. All of this being said, as we've transitioned over the past 2 months with a mindset that the activity team would not be going into those isolation areas, but as the isolation precautions in those areas have increased in numbers, we've really, I've advocated to incorporate mostly myself to cross that line and get in there with the appropriate PPE. Day by day, we all know that there's not as many staff members who are as willing or able. And when I say staff members, I'm talking across the board, whether it's nurses or housekeepers and activity staff who are willing or able to go into those areas that have a little more critical care. So in the past couple of weeks, I have actually advocated and worked with the state in understanding my perspective to still assess the residents and find out some of the things that they need, or to get that first on visual assessment and conversation with them. We do accept admissions right now that are COVID positive, so we do still need to make sure we are able to access those residents for complete assessment.
Excellent. Thank you to both Jan and Talia for your time this afternoon in regards to sharing some of the things that you're doing in your communities. These are some vital things that hopefully everybody can glean from and understand the importance of why activities are essential and needed as it comes to with COVID-19 and at any time, you know, and the importance of that and understanding that. Thank you, ladies, for your time. Some of the things that we can share with you too now are some resources that can help you to increase the engagement opportunities that you may be having with your residents. Hearthside Book Club has a lot of free books that are available online that you can access and do book reading opportunities with the residents. This is something that can be done maybe with your higher functioning residents, but it could also be done, you know, to just read to a resident. Sometimes it's important to be read to as well. And so thinking about the ways that you can provide that access. Recreative Resources is another free access right now. They have lots of opportunities for engagement on their website that you can utilize and access to on a regular basis. Also, virtual field trips. This is more of a homeschooling thing, but it can be utilized with your residents of all levels because it does different field trips throughout the world that can have a good experience as well. And, you know, opera, all the operas have been recently released too. So if you have a resident that's a huge opera fan, here's the resource to be able to access that as well and to see what's happening there. Many, as we know, many of our entertainers are high-class entertainers have really issued out their concerts, and they're available through this website as well, or you can certainly use YouTube to access. A lot of the entertainers have been doing concerts in their home, and they've also released their own concerts. I know like Taylor Swift just recently released one of her concerts that was broadcast on ABC over the last weekend. Other thing was national parks. I talked about that briefly at the beginning, where every single national park now has their video cams available where you can watch what's going on. So if you've never had the opportunity to see like Old Faithful explode, you have the opportunity now to do that, where you can access this and have the experience of watching Old Faithful do its thing. Other things, there's other virtual field trips that are available on this resource page that's there as well. The Daily Perk has offered 2 pages packets every day for free. So this is a great resource too that's available to offer engagement experiences. EverSound is another great resource. If you're not familiar with EverSound, they have created headphones for our residents who are hearing impaired, and you are able to talk from anywhere in the building while the resident has the headphone on and they can hear what's going on. And this is really great too. And they have a lot of great live programming and membership, free membership opportunities right now during this time. Senior Living Media also has a lot of free downloads that you can do with coloring pages and other things that are accessible and easy to reach out to. One of the last things I want to touch on is how vitally important self-care is for yourself. A lot of times we forget about us. You know, here we are, we're caregivers, we're the frontline workers, and we're doing so much to ensure the needs are being met of the people we serve. And we are not really taking good care of ourselves. So these are some things that I have found that have been very helpful that I wanted to share. Rule number 1 is to listen to the experts and not to social media. This has been really challenging because we can read all kinds of things on Facebook and Twitter and Instagram and YouTube, but really listening to the experts will help us to recognize what's truly going on and what truly, you know, we should be doing as healthcare workers. Rule number 2 is to make sleep a part of your routine, just as I talked about how vitally important it is for the residents to have proper sleep and training. We need to be doing the same for ourselves. Rule number 3 is to exercise and eat right. You know, a lot of people will be coming out of quarantine with what they call the quarantine belly. And so we really need to look at opportunities to really engage ourselves still in exercise and the abilities to be able to keep moving and to eat healthy as best we can. Number 4 is to schedule your self-care time and don't let others take it away, whether it be taking a bubble bath or just taking a nap or resting and binge watching your favorite TV show. Having the opportunity to just do that so that you can relax and be able to improve on yourself for the next go round, so to speak. And then rule number 5 is it's okay to say no. This can be a really challenging time, especially working in healthcare right now, where it can be difficult to say no because we want to be there, we want to support our patients, we want to support our staff, and we want to be engaged and involved as best as possible. But we also need to realize that we can't do it all either, and it's okay to say no. So these are some key things to really think about as we come into that. As we come to the conclusion, there's just a couple of final thoughts I wanted to share with you. Remembering that, you know, activities is an essential part of the plan. Whether it be your level of living, it doesn't matter. So if you are adult day healthcare, if you are pediatric skilled nursing, if you are skilled nursing all the way to assisted living, memory care, or independent living, activities is an essential part of our life. And that engagement is more than just bingo. As we continue into this uncharted territory and recognizing, you know, the importance of activities services over programs, we really need to look at ensuring that the functional mobility and the psychosocial well-being and the spiritual support are being taken care of. One of the things I've been researching and talking with, you know, as part of my role in the national organization, is I reach out a lot to other national organizations in other countries. And it's been interesting to the healthcare workers in other countries around the world and what they're doing for COVID-19. And one of the things that was really discovered is that the United States of America focused on the medical model of care, while every single other country is focused on the social model of care. And that is a huge difference between the two. And so it's vitally important that we recognize how activities plays exceptional lives of the seniors that we cater to, and even the children if we do. So I have on the screen now my contact information, and I also have these 2 websites that are listed here. So if you didn't have a chance to really look at the website I shared with you earlier, you can access either one of these websites directly to their COVID-19 resource pages, and they will have all of that information with direct links. There's so many other free resources. So many organizations have stepped up to provide free resources and opportunities. And this is to be able to access all of these resources and being able to find the things that you may be looking for. If you have any that are not listed, please send them to me. We'll get them uploaded. Other professionals throughout the world can have access to them as well. So we've come to the time to, if there are any questions, I'm more to answer. And I think and Talia are still on too, so if you have any questions for them.
Thank you, Elisa. Jeff West has been monitoring chat for us, and let's see if there are any questions in there. And while you're entering your questions, if Lisa, if you could go to the next slide for me, please. Just wanted to briefly tell you about our Comagine Health initiative. We are embarking on a partnership to reimagine healthcare, working with providers across all of the healthcare settings on issues like improving patient safety, increasing access to behavioral health, addressing opioid misuse, and improving care transitions by reducing admissions, readmissions, and emergency room visits. Providers who join the partnership will receive expert coaching and technical support, education, and resources, and will have access to their performance measures via our new interactive data called Data for Change. This is no cost to you. Joining is easy as clicking on the link in chat to sign up, and I'll put that in there in a moment, or put your name into chat and one of our team leads will follow up with you. If you found benefits from participating in the session today, please consider joining us. And so Jeff, if you would please let us know if there are any questions.
Sure. First off, there's something just to share. I wanted to point out to folks, there's a great idea about giving the walkie-talkies to the residents so they can communicate with each other during bingo and activities. I think that was mentioned before, but it sounded like a really good idea. Then there was a question about activities specifically for the higher functioning, more active residents. What do you have any special ideas about how keeping this group of residents involved and motivated? The person with this question saying they're having a problem with that. The majority of the activity participants are go-getters and they're becoming disinterested because they want to socialize and do things together. Do any of the panelists want to take that on?
Well, I think that's a great question because, as we talk about our higher functioning residents, it's a challenge because they are used to being so active, engaged. And I think Talia really talked a lot about the things that she's doing in the independent living. And I see that she had to step away right now, but the other things that you could be doing. I love the walkie-talkie suggestion, and why not bring that into to this setting as well to allow the higher functioning residents to have the ability to communicate one another. Maybe you could set up FaceTiming with each other. We know that technology is not personal, and so we can recognize, that can be challenging and struggling for many of our residents. At least they would have the ability to still socialize, and utilizing technology for that socializing. Set up Zoom meetings with your residents so that they can see each other and engage in that avenue, and they're familiar with each other too. And that could be something that could be considered.
And I'll just point out one other great idea that came out here is that there is an internal talent activity. So they're using co-workers and folks within the facility. The people are already there. They're not bringing in outside folks, but a talent show from people who work there.
Wonderful. I think that's awesome. We do have so many talented employees, and this is the perfect time to really have them be engaged and involved. Definitely.
So that's all that's in the chat that I can see right now.
Thank you, Jeff. There are daily huddles that are being provided through the Institute for Healthcare Improvement, and I had the pleasure of listening to that today, and they were sharing how the activities staff there have created like walking routes around the neighborhood where their buildings are, and taking residents out like one at a time to go on those walks. So maybe that's something that, is anybody maybe doing that in your facility?
I know that there are several communities, on the East Coast that they're slowly coming out of this quarantine, that are independent living, that have started to do certain activities like that, where they are doing walks around the buildings and performing that. And, we have perfect weather right now to really be able to engage in this as well. And I know we all have, patios and lounge areas outdoors that are also like interconnected in the community, that don't really have access to the outside. And these are great tools that may not be used right now either. And definitely one at a time would be a perfect opportunity to really start engaging the residents outside of their rooms. And as long as you're following the proper, infection control techniques, you're wearing your masks, you have the proper PPE on, I think it's a very appropriate thing to be doing.
Excellent. I noticed in the chat that Stephanie Rostrom, I may not be saying your name right, I apologize if I'm not. She was the one that shared about the walkie-talkies, but I also noticed that during Nursing Home Week, they had a theme of the 1980s, and we're taking residents to photo booths. And I love that idea, and would be really interested to hear a little bit more from Stephanie about how you created a photo booth.
National Skilled Nursing Care Week was a great opportunity to really engage our residents, maybe not in the that we're familiar with and used to, but I really liked the theme for last week was sharing wisdom, and how we could take that engagement experience and be able to share wisdom with each other. And I love that 1980s theme. I think that was a great idea. Good work.
I would really be interested to know how many buildings have created a closed circuit TV or an internal TV station for programming. That thought really fascinates me. And I know our building up in the Northern Nevada State Veterans Home has been doing chaplain services 2 or 3 times a week that are broadcast through that channel, and they were going to be working on activities. Has anybody tried to do that here? I was trying to look through the chat real quickly to see if anybody's answering that, but I was fascinated by the idea of creating your own programming and sharing that with your residents, and having it individualized to the building itself.
Yeah, I think that's a great, I know Southern Nevada Veterans Home has been doing the same thing. And there are several facilities here in the community that have, you know, closed televisions, in-house channels, and that they can use. When I worked in one of the communities I worked in several years ago, we had it. We showed movies on it all the time, but now you can take your computer, connect that, and be able to do broadcasting from wherever that, you know, that box is, that you can broadcast out to your communities as well using that closed circuit channel.
Yeah, it looks like Meg and Eddie says that their veterans home has an internal channel that was set up by their maintenance. Chaplain and worship 2 to 3 times a week on our house channel. The administrator led a live country drive on it for us all to see. Oh, so the administrator drove through the country, what he's doing, so that you could all see it, or she?
How fun.
She says, yep, on Skype. That is amazing. That is a great idea to have staff actually do something live to share with your residents. What a fascinating thing to try. Let's see. Oh, Valisa Way says that right now they're working on a summer project of creating a photo journal of weekly things with the residents to send their families each month. What a great idea. I'm really interested to know what people are doing to try and get residents up in their rooms to move. You know, are you doing exercise activities? Are you doing dance contests or something that actually has them moving while they're in their rooms? Even bed mobility activities would be something maybe. Check in Skype or check in chat to see if anything's going on here. As we draw to a close, I want to thank everyone for taking time to join us today. I know that this is a really crazy busy time, especially for our activities professionals and trying to prevent the isolation from getting to the seniors that we care for. Please join us again for our next half-hour hot topic. We provide those on a monthly basis. Those webinars are designed to support your efforts and to provide great ideas for caring for the residents in a 30-minute time frame to accommodate your busy schedules. The next session will be on June 19th, and the presentation is going to be boosting your mental health during a crisis, and our presenter will be Dr. Alexis Kennedy. She's going to explore practical steps for boosting your resilience and mental wellness. So look for information coming out about that before, within the next week or so. Once again, I'd like to thank our presenter, Elisa Tagg, and the 2 ladies that she had join her, Jan Swallow and Talia Jones. It was a wonderful exploration of things that we can do to support our residents during this really critical time of maintaining their physical and mental well-being. One last check to see if there's anything in chat, Jeff, that we would like to address before we sign off. Oh, I like this. Danielle Goins is saying, I have interactive fitness for bedbound and in wheelchair.
I was muted, I'm sorry. There was one question that was brought up about 2 high-functioning residents who are separated and the walkie-talkies don't work for some reason. And there was a question about if they had any other ideas about how to include these folks. I think the question may be about how to bring them together in a way that was safe.
What setting are they in, if I could ask that question? Do you know what, is it long-term? Is it skilled nursing? Is it assisted living, independent living?
Let's see.
So I see it's skilled long-term care. That's a real challenge right now because the regulations state, no group programming, and two or more is considered a group. So you have to be really careful with that, as you work through that process of understanding. And so it's a real challenge right now. Maybe they could write letters to one another. I don't know, maybe go back into the old way of thinking and write letters to one another and have pen pal experience at this time. That's definitely a challenge. Or you could take one out of the room and take them around and come around to their window of their other person's room, and they can communicate through the window. Mm-hmm. Oh, and I see Leah just said the same thing.
Yeah, I really found it fascinating. I think it was Talia that was saying that they did bingo where people had to like call each other or whatever to find answers to certain questions, to so like who hasn't gotten out of their pajamas today and things like that. That to me was a really interesting way to keep the residents connected to each other. And I hadn't actually thought about how do you keep them connected to each other. I was just thinking, how do we keep them from, feeling isolated? So, silly me for not even thinking about that piece of it, right? So Elisa, again, thank you so much. This was a really wonderful presentation on how to engage and be creative in how we interact with the residents and the things that staff can do, because it's not just the activity staff that are being challenged, as Jan pointed out, that it was the other staff that had to engage with the residents as well. So thank you very much, and I know that you've put your email out there for people to contact you if they want to find out more. And if you didn't capture that in the chat or on her slide, feel free to reach out to your state lead, which hopefully you know who that is in your state, and they can get the contact information to you. This was recorded and it will be posted so that you can share it with other people and review it at a later date. So again, thank you everyone for joining us today, and we hope that you'll join us for our June 19th half-hour hot topic. Have a wonderful day.